There's a new procedure that's gaining some popularity, which is removing ribs to make your waistline smaller. Now, why would anybody ever want to do that? Well, there are a lot of patients that are built straight, that the distance between the edge of their ribs and the top of their hips is pretty short, and it doesn't allow for the waist to have a curve to it. So if you want to gain that curve, you've got to make room, and the only way to do that is to remove the lowest ribs. Now, the lowest ribs don't serve too much of an anatomic function, a little bit of protection, but they are what we call floating ribs. They're not rigid, and so they do move, and taking them out probably doesn't compromise the protection of your body so much, but it has a lot of risk. If you have the operation done, it's done through a small incision, the rib is kind of exposed and dissected all the way around, and then a saw is used to cut near the base of it so that you can take the rib out. And sometimes you do more than one rib. Sometimes it's a couple of ribs on each side. Now, it's not without its risks. Going through that dissection can lead to bleeding. Of course, you can always have infections. And one of the most serious things that can happen is you can actually puncture into the area of the lung, making the lung collapse. That's a serious problem to have to try and get a narrower waist. Now, if it's really important to you, it can be done safely. It can be done by doctors that have lots of experience. But if you ask me, it's a long run for a short slide, a lot of risk for just a little bit of improvement.